Hello and welcome to 100 Years of Service, Life, and Celebration for WO1 Joseph Ashite Hammond, World War II veteran. I have a short presentation to just show what the health sectors have been doing within the community. The presenter is myself, Dr. Alice Ophelia Abe, along with Daniela Tayua Bafo Ameyao, MPH. I will be showing some interesting things that we've discovered and what plans we have for the coming year. I'm also known as Jagbecho Anyenogun Abe. Cleopatra Community and Health and Development has been in the community for several years. Along with Absolute Healthcare and Joseph Ashite Foundation, we are here to serve the underserved communities. We are located in La Wireless, Accra. Our main commitment is building a better future for all children and their families, starting with the present. We are also the medical wing for Gan Adangme Alliances with S.org. Our core belief is for every child to be able to have a safe school environment, protecting children and adolescents from abuse, addiction, illnesses, and trauma. And we're focusing on building up communities, especially the ones that's severely underserved. Any small impact in a child's life makes a big difference in the type of leadership skills or opportunities that they will have in the future. What is SAFE? SAFE is building future leaders. The acronym stands for Substance Abuse Free Environment. The youth, through our program, will undergo a structured orientation program which focus on critical thinking skills, leadership roles, and economic activities. So we're here to help the young ones coming up, and we do have a program called Head Start. So simply Head Start means we're starting with the children as young as 4 and 5. So we're building these leadership skills and critical thinking within them so that they could grow up to be better leaders in the future. With the agency of the Safe Pledge program implementation, we're hoping to reach all the school clusters that we are currently working with. And the reason why we're doing this is because of the increased use of tramadol, marijuana, alcohol, and shisha by children as young as 10. Also, there's the increase in alcohol with teenagers and teenage pregnancies. The shisha is perceived as something cool, but unknown to the children, their developing brain, which will not be developed until they're 26, can be greatly impacted, also along with their lungs. Youth are vital to Ghana's future. So I'm asking all our leaders here today, when you go back to your towns, please let's enforce the laws and let's make sure nobody's selling alcohol to minors. And also let's eradicate the shisha and hookah from our environment. This is not our culture. Especially in La, where I'm from, there's abundance of shisha bars. So we really need to eradicate this and make our environment safe for all. Another way we're helping the children is by teaching them on growing hope through school gardens. CCHD is working with the wireless cluster schools and currently is teaching students on the importance of growing vegetables such as tomatoes and peppers, etc. Gardening nurtures pride, purpose, and life skills. It's a hands-on learning experience beyond farming. What we need to continue our work, especially the medical wing, is for us to be able to do more outreach and also more screening. Recently, we screened over 200 individuals in the last 2 months, free from our own finances, and also provided referrals along with resources and lab work. We want to be able to expand our program, so therefore we need a medical clinic van. And we also want to help with education for the STDs, sexual transmitted diseases among the adolescent and the children, and mental health services. So with our van, we'll be able to bring services right to the community where it's needed. We also need more seeds, more pots, and more fertilizers to help with our school gardens. So all the schools under us will be able to start growing their organic gardens. Every donation helps, but just simply spreading the word is greatly appreciated. Thank you all for your time. This is just a short presentation, but we do have more data, including research on things that we've been doing in a community. So we're just looking for all stakeholders, to partner with us or to reach us and to ensure that the next generation is going to be much healthier, and also to be able to sustain this long-term success for the 24-hour economy that we have in front of us.
Hi, my name is Daniela Balfour Amayao. I am the Director for Cleopatra Community Health and Development. The SAFE program, Substance Abuse Free Environment, aims to prevent substance abuse. We want to implement targeted prevention campaigns and education to deter youth and vulnerable populations from starting drug use. We want to provide and develop life skills and preserve livelihoods by equipping the youth and recovering individuals with vocational training, employable skills, income generating opportunities. All of these things can foster resilience and reduce any risk of substance abuse. Furthermore, we want to strengthen community awareness and action, mobilize communities to understand substance abuse risk, recognize signs, reduce stigma, and actively support prevention and recovery efforts. Lastly, we want to advocate and support policies. We want to engage all stakeholders and advocates for improved local policies, resources and environments conducive to preventing substance abuse and supporting recovery initiatives. As one, we can all do our part, but I thank you so much and I want to bolster our efforts for the SAFE program. Thank you.
Thank you again for listening to this short presentation on the SAFE program. We do have a little bit more information, including data and research, that we can share with each and any individual that would like to reach out to us. Our project manager is Emmanuel Abe. His number is listed here. You could also find him in the audience. If you need to reach us, you could also go to Ga Adangme Alliances with a s.org, and you can send us information there. You can also reach us through Joseph Ashite Hamon. Again, we are here to celebrate the incredible 100th birthday of WW2 veteran Joseph Ashite Hamon and all our grandfathers who also fought in the war, including my grandfather, Enoch Lawrence Laye Yemofil.